Alright, you guys, welcome back to the channel yet again. My name is Matt, as you saw from the awesome intro. Isn't that intro awesome? I'm really happy with it. It literally took about 10 minutes to make. But compared to the previous thing, which I think looked something along the lines of this. Yeah, no. But anyway, today's video is going to be a little bit different. It's going to be a little bit more of a rant and kind of sharing some frustrations I've been having recently for a long time, but they're in my head a little bit more recently. And they come from a video from a new channel that I found recently. So this isn't like a review of his channel or anything or his content. Although I think his content and his channel are very good. And he has a lot of good ways of phrasing things and thinking about things that I haven't. And that's part of what's prompting me to make this video. So let's get into it. So this channel that I'm referring to that I recently found is, it's called I Am Phil's Bipolar. That's what it looks like right there off of YouTube if you're looking him up. You'll see that he has that really cool, like, red and white, like, effect in all his video thumbs and stuff, and in the videos, and I have no idea how he does that, but I think it looks really cool. But there he is if you're trying to check him out. There it is. And basically, I've watched all of his videos at this point. He's diagnosed bipolar 1 with psychotic tendencies after over a decade and a half of symptoms, which is a very long time. And so this is kind of his journey that he started a couple years ago, as he started to be diagnosed and then started different medications and treatment. So it's interesting because I actually stumbled upon a video of his originally searching up kind of reactions or side effect videos related to what I'm currently on, which is the generic for Tegretol. And his video came up, I watched it, and immediately fell in love with the channel, and literally just watched all of his videos. And it's a shame we don't have anything current. I think the last thing was like 5 months ago, but hopefully he'll post again soon with an update. But either way, a cool channel, and his video is very informative. And then I started coming across some other videos that really made me start thinking, and that's the basis for this video right now. So obviously, if you've been on here for a while, you know that I've done many videos on treatments and kind of myth-busting with medications and therapy and expectation versus reality. Well, he did a video where he basically broke down his frustrations with psychiatry and with treatment and medications, and again, that kind of expectation versus reality. People think that you're just going to be put on some pills and you'll magically be better. And of course, I've discussed more times than I can count that this is not how it works. These medications have real side effects, real risks, and it takes a long time to figure them out and get on the right stuff. And even then, as he explains in his video, which is, I'm really glad he did, because a lot of people seem to leave this part out. Even if you do find the cocktail of medicine that works for you, that doesn't mean that it's going to be your forever cocktail of drugs that's going to work for you. Over time, your body metabolizes stuff differently and all of that, and therefore, of course, you are likely to stop responding as well to certain medications, and then you have to constantly play and tinker with this dose or different medications, swapping stuff out. It's a never-ending lifetime journey of just trying to manage your emotional stability. And, he became quite emotional in this video, but I'm really glad he did. He says in the beginning, he edited in a clip where he talks about how he was, it was hard to watch him film this kind of stuff, and he was going to just cut all of that out. But he wants his channel, just as I want my channel, to be an accurate, real representation and not just glamorized and glorified, and oh, it's great. You just take these pills and you'll be fine. It's not that easy. And so he left those parts in, which was great. And I feel like I kind of fall into the same trap of kind of seeming a little bit more positive sometimes about some of this stuff. So in this video, I'm basically going to kind of echo a lot of his thoughts and sentiments about psychiatry and medication and treatment. And the way it really works. And then I'm going to leave you with a great analogy that he used that I've never heard someone even come close to describing. And it really describes the intricacy of treatment and all of that. So my first frustration with medication and psychiatry is the fact that it takes so long to even be diagnosed accurately and even started on the right meds. I have only started on medicine, I think we're coming up on 3 years next month in January. About January, February, I got started on my first antidepressants because at the time I went to my primary for just depression, anxiety after the murder of my father, and I started on Lexapro, and then went to Wellbutrin, and then Cymbalta, and at that point went to a psychiatrist where we started all the not so good times. So I will list all the medicines I've been on so far. I did in a previous video when I first started the channel way back, almost a year ago. So I will list the full version as of now in order of everything I've been on so far here, so you'll be able to see that. But either way, it takes so long to get even started on medicine. And even then you have to really be your own advocate. And the way he described the difference between when you go into the psychiatrist office, your role versus their role. He did it really well. And I'm really like amazed at how he really described this so well. And he basically said, you as the patient, you have some of the pieces. You know what's wrong with you. And you know your symptoms, what you can and can't tolerate in terms of medication side effects or issues. And they have all the medical knowledge. They have all the internal knowledge of, the medicines, the methods of interaction, of activation, on the list of side effects. And juggling all of that together to try to find something that fits your criteria that you give them. And going to this analogy that he came out with to describe this kind of intricate balance of this relationship that you're trying to have with your doctor. It's like you're stuck on an island or a country. You have no idea where you are. And your doctor has a map of where you are. But he doesn't know where the hell you are on the map. He just has a map of where you are. And you can obviously look around you and try to find things in the environment that can give you clues as to where you might be. Which is all well and good. The only problem is, he doesn't have a smartphone that you can just send you a picture of the map. He can only send it and communicate through a walkie-talkie. And that's how he can guide you with this map that he has. So, in terms of the metaphor, you look around, you look inside yourself, and you look at symptoms you have. And behaviors and all of that. He's looking at the map of the DSM. He's looking at risk factors. He's looking at all these different things on his end and her end internally. And trying to figure out, where you might be in that great big country of wherever the fuck you are. So it's constant back and forth. And it's constant juggling that kind of communication. And it's combining those things together that hopefully lead to where you need to go, which is a diagnosis, which is hopefully successful treatment and all of that. But that, I thought that was just so fucking brilliant to describe it that way, because people get lost in that idea, like I mentioned so many times before, where it's not about just finding medication. It's the whole road to get there. It's the whole road of taking them and dealing with side effects, or dealing with adverse reactions, or dealing with no reaction at all, and spending 2 months on something that has done absolutely no change at all for you. And in my book, that's where I've been most of the time, and it's terrible. And it's like I'm wasting years of my life away taking stuff that hasn't shown any effect whatsoever in any meaningful way. So, at the end of the day, medication and treatment, you know, society blasts the hell out of us and has all these misconceptions, which I've already covered so many times before, but this never-ending stigma, it never fucking ends. And, you know, people are always so quick to point fingers. They always want to have something to say. Just do this, just do that, just do the other thing. And it's all bullshit. And it's never as easy as it looks. Most things in life are, and I think people by now would probably be able to figure that out. But for some reason, for mental illness and mental health stuff, they don't think that way, or they don't think that it applies that way, unlike the rest of life. And the last thing that he covers in this video that is so relevant, these disorders are permanent. There's no cure. Like I said, it's a lifelong game of management, of symptoms, of, you know, patterns of behavior and therapy, and all of that. But at the end of the day, I'm going to have this forever. And it's living with that is a little bit harder to deal with, because it's not going anywhere. And with age, it will get worse. And with unsuccessful treatment, it will get worse. And it really sucks having to acknowledge that. It just kind of is what it is. But people who just have this idea that it's just going to go away somehow if you just take these pills and talk to someone about it, it's ridiculous. You know, so I wish more people would understand that part of it. And I hopefully one day they will, because that would be a big step in the right direction for people to actually start being a little bit more helpful and a lot more understanding. So hopefully that will happen soon. And I just thought overall the videos, I mean, some of these videos really summed it up really well. And I thought it was phenomenal. So that's all I can say about that. Definitely check out his channel. Again, I am Phil's Bipolar. And check out the next video, which should be all about that article that I mentioned in the beginning, the 10 signs that your mental illness is for attention. And watch me rip it to shreds over the course of 2 videos. It's going to be great. I know you're going to like it. So that's it for this video, guys. Thanks for checking it out. Let me know in the comments what you think about psychiatry, what you think about this analogy that Phil came up with, and how relevant or accurate it is to your life. And definitely let me know in the comments. Give the video a thumbs up if you thought it was helpful. Share with your friends, anyone else that might find this information useful. And I'll see you in the next video.